Hello, this is Dr. Molly McMullen Laird from the Rudolf Steiner Health Center, and today I would like to talk a little bit about taking temperatures. Our patients are often required to take their temperature once or twice a day and record it for us so that we can make decisions about their treatment, especially if they are getting mistletoe, but there are many other reasons why a patient may need to take their temperature. So first I want to show you a typical digital thermometer. Most people are using this kind of a thermometer, and you just press the button and then you'll see the display. It will usually show the last temperature that was taken, and it will blink when it is taking the temperature, and the blinking is an F or a C. If the blinking is an F, that means Fahrenheit, which is how we usually record our temperatures, and if it's blinking C, that's in centigrade. To change it from Fahrenheit to centigrade, you just hold the button down and then it will switch it, which I'm not going to do right now because we want to keep it on Fahrenheit. So the next part of the temperature taking, once you have that says that it's done. That's the alarm saying that the temperature taking is done. The next thing I need to show you is where to take the temperature. And if you look at this diagram, you can see that there is a heat pocket in the back of the mouth. Not in the front of the mouth. This is where the front teeth are, the incisors. But the heat pocket is all the way in the back, on the side of the tongue, between the molars on either side. So that's where we want you to aim the thermometer. And then you put the thermometer in, and it will beep when it is finished, and then you can record it. So for recording purposes, we at the Rudolf Steiner Health Center, we use a sheet like this, where the patient can write down the date and the time that the temperature was taken, and then a little symbol, either an O for oral, an R for rectal, or an A for axillary, which is under the arm. And they can put their recordings down with a little note in terms of how they're feeling, or perhaps which dose of medication they had that day. Any other examples or any other conditions can be written in that extra space. Some patients prefer to use their phone or a 3x5 card or a calendar to record their temperatures. It doesn't matter, just as long as you remember to bring it to your appointment. So recording is up to you, however you would like to do that. One thing to note before you take your temperature is that you should have avoided any hot fluids or cold fluids, obviously, and any extreme exercise. When we exercise, our temperature will go up significantly, and it takes about half an hour for it to come down. So if you've been out working in the garden or running up and down the steps or going to the gym or something, then you need to wait about half an hour resting before your temperature will be reliable. Now, in order to take a rectal temperature, because some people, even though they might have the thermometer in the right place, they might not have good oral temperatures, that their oral temperatures may not be reliable. So in order to determine that, we would take a rectal temperature at the same time that we're taking an oral temperature. So this being your thermometer, you can take your oral temperature first and record it, and then you take a plastic sleeve that comes with the thermometers, or you can buy one, extras of these in the drugstore, and you put the thermometer into the plastic sleeve and then peel back the paper. And then if you're doing a rectal temp, this would be put into the rectum about half an inch. It doesn't have to go very far, so you can lie on your side, or you can do it in the bathroom or in bed, whatever is most comfortable. People are not familiar with doing this, but once you've done it a few times, all of our patients learn how to do it, and it's fairly easy. A rectal temperature is the most reliable temperature. So that's our baseline. The oral temperature should be about a half a degree lower than a rectal temperature, and an axillary temperature will be another half a degree lower. So that's why we have to write down whether it's rectal or oral or axillary, because those temperatures will vary depending on where the temperature is taken, and it's important for us to know where the temperature was taken. So I think that covers everything I wanted to say about taking temperatures. It's very important to us. We want to make sure that the data is collected properly, because we're going to make treatment decisions based on your temperatures. And everyone should learn this skill even if they're not in need of it right this minute, because you may have a child or a parent or someone in your family who needs temperatures taken. So thank you for listening.